So one factor that everyone is watching closely, of course, market participants, investors, economists, businessmen, and I think every Indian, to be honest, is what is happening with the COVID-19 cases. So the buoyancy in the economy is based on the hope that the worst of the second wave is behind us, that a third wave may not be coming, or even if it comes, it won't hit us too hard. But is the data backing that? We cannot make the same mistakes we made earlier this year in 2021, which is why it's very, very crucial to watch the numbers carefully. I'm talking about all the indicators that we usually see when looking at COVID infections in the country. Now, the Health Ministry today, in its regular briefing, also warned that the second wave is far from over. A couple of things that are bothering them is that infection rates are higher than 10% in over 40 districts, and the R0 rate is higher in 8 states. Listen in.
हमें जानना है, हमें मालूम है और हमें ये भी जानना है कि डेल्टा वेरिएंट हमारे देश में फैला हुआ है, डोमिनेंट प्रॉब्लम है, वेरी डोमिनेंट प्रॉब्लम है, और यही डेल्टा वेरिएंट ग्लोबल पेंडेमिक का भी अब हिस्सा बन चुका है। और अमेरिका में 30% इंक्रीज हुई है न्यू केसेस में, वेस्टर्न पैसिफिक रीजन में WHO के 25% इंक्रीज हुई है। तो द पेंडेमिक इज स्टिल रेजिंग एंड पेंडेमिक इज स्टिल परसिस्टिंग। द सेकेंड वेव इज परसिस्टिंग इन आवर ओन कंट्री एंड वी आर कंसर्न्ड दैट some states have an R0 which is in the wrong direction. Please remember that this R0 had come to 0.6 and below, or so around that. And now if it is above 1 and if it is rising in some states, it is truly a cause for concern, shows that the virus wishes to expand. Pandemic has a tendency to still expand, and we must curb it with all our might.
Professor K. Srinath Reddy, President of the PHFI, that's the Public Health Foundation of India, is joining us to help us understand what really is going on. Welcome to the show, Professor Reddy. Great to have you on. First, your assessment of the numbers. Are we seeing a change in the upward direction over the last few weeks, which makes sure that we should be careful right now? Are we seeing again an uptick in cases?
Absolutely. I think we started padding up for the third wave even before the second wave declared its innings. And we are seeing the second wave still continuing in some of the states, unabated. And for example, in Kerala, there was a plateauing, but that's not really coming down. And similarly, in some other states, we are seeing in the south, the numbers going up. The northeast is also an area where the numbers are going up. Therefore, we are definitely dealing with a prolongation of the second wave in some places and the likely eruption of the third wave in some other places. We'll have to anticipate that because this country is not having one state insulated from the other states. And there are still a large number of people who are susceptible, as even the antibody survey showed of the ICMR. Secondly, let us recognize that this R0 is also, in a sense, an underestimation. It only gives you a trend. It doesn't necessarily tell you how many people a person who is infected is infecting among others, because it depends upon the testing rates. If you're not testing much, then you will not find many new infections. And secondly, some of the people who are infected may be asymptomatic or mildly symptomatic and may not get tested. So what we are really looking at the R0 is as a trend indicator. And that certainly is worrisome because it's going up. And therefore, we ought to really crack down in terms of our public health measures to control, even as we are stepping up the vaccination.
No, so, Professor Reddy, is this a Kerala problem? Because as of last week, 50% of the daily cases were coming in, or the new cases were coming in from Kerala. Now, there's a lot of back and forth going on about it, and it's become political for some strange reason. The Kerala government says that, look, we control it so well earlier that, less of our population has been exposed. That's why cases are higher. On the other side, they're being accused of being lax. So we'll leave all of that aside. But numbers-wise, Is this largely just Kerala, or are you seeing an issue in other states as well?
Well, as far as the numbers who are infected are concerned, we have to recognize that it depends upon the numbers who are susceptible in the population, and among them, how many are exposing themselves, and among those who are exposed themselves and suffered some symptoms, how many are being tested. Now, Kerala says that they are testing quite a lot, and therefore they're detecting many cases, and the number of susceptibles in that state are still high because their previous control measures were successful, and even the ICMR survey showed only about 44% of seroprevalence, and therefore it's not a surprise that you're seeing many more cases currently coming up. But that does not really preclude the fact that we ought to control the exposure of people to the virus so that the new cases really do not rise in such a rapid fashion. It's good that they had controlled very well, but we must continue to control very strictly even now as we step up the vaccination rates. But there are other states too, which are actually showing this trend. And that is worrisome, particularly because some of the neighboring states in the south, as well as some other states elsewhere, are showing an uptick in numbers. And therefore, one has to really watch the situation and make sure that the contagion doesn't spread again to others, because almost every state has still a reasonable number of people, a substantial number of people who are susceptible, some more than others. And therefore, if the virus is given a free run, then again, we'll see the numbers going up.
There is, give us a sense of this, Professor Reddy. There's one school of thought that says the Delta variant is what ravaged us in April and May, and which is what we're seeing the world around. Even populations that are more vaccinated are suffering from the Delta. Are we now likely to be relatively more inured or protected because we've already seen the worst of the Delta? Are these new variants that could be fueling a rise in cases? Or is this just, as you put it, the susceptible population who still didn't get COVID-19 or a vaccine that is now getting infected?
Well, it's very likely that it's the susceptible population that's more reflected in the numbers that we are seeing, though we are also seeing some reinfections. But fortunately, so far, the reinfections are less, and they're not resulting in serious infections requiring hospitalization and intensive care or deaths. But we do need to protect people with full vaccination, particularly those who are vulnerable, to make sure that they are not going to fall prey to the Delta variant. But we should not jump to the conclusion that everybody who tested positive in the antibody survey of ICMR is currently immune. Firstly, those antibodies are not tested for the neutralization ability. We do not know how much they can neutralize. Secondly, we do not know how many of those antibodies were acquired by exposure to other forms of the virus other than Delta, whether the original wild virus or the Alpha variant. So given that fact, we cannot bank upon only the antibodies detected in the ICMR survey to say that all of them are immune. But given the fact that many would have been exposed to the Delta variant as well in the last few months, and that many more have been vaccinated, I think the number of people who are likely to get serious infection will be among those who are not previously exposed to the virus and who have not been vaccinated.
As far as the rate of vaccination is concerned, today the Health Ministry revealed that around 50% of adults have had one dose, 18-19%, if I'm not mistaken, have been covered completely, and we've seen a big bump up in July compared to the months before. But is this pace enough to ensure that we don't see a prolonged third wave?
Well, I think we do need to raise our vaccination rates. And we are being told by the government that this will happen in later part of August and possibly thereafter, because the vaccine production of the 2 licensed vaccines in the country is going to go up, and perhaps some more vaccines are likely to be licensed after they complete the trials and are reviewed by the regulatory authorities. So we'll have to keep our fingers crossed to see how much the supply chain actually gets expanded and how fast we can really increase the vaccination rates. In cricketing terms, the asking rate is increasing, but we ought to increase our strike rate as well in order to ensure that we close the gap. But I believe if we get all the vaccines that are really on the horizon fast enough, then we ought to be able to pick up speed from latter part of August or September.
You know, an interesting experiment of sorts that New York City is now trying to do, and one which would be valuable in our context as we're trying to open up, preparing and padding up for the third wave, hoping that we control infections, is they are now saying that only those who are fully vaccinated can go to certain areas like indoor dining, like entertainment, like sporting events, and they have a whole list of things. Do you think that's feasible or something that we should look at least in our large cities, after some time when the vaccination rates improve?
Well, I do not think that is the approach that we can follow for several reasons. Firstly, New York City's vaccination rates have been very high. So the number of people who are actually affected by this regulation, which is a sort of penalty for the not getting vaccinated, that is not as high as people in India who are still to get vaccinated even though they want to get vaccinated. That's because of the relative shortage of vaccines that we have now. And given the relative low coverage of vaccination so far, you can't shut the doors on the vast majority of the population. But the second thing we must recognize is the latest CDC report shows that even if a vaccinated person gets infected, they carry a fair amount of virus and they can infect others. So it's not as though the vaccinated person is totally liberated from the risk of being infected or becoming a transmitter. What is protective is wearing a mask. And what is protective is good ventilation. As long as these two are very strictly prescribed and followed, we can cut down the transmission rates quite a lot, apart from, of course, preventing super spreader events. So I think the New York example is not really relevant for us.
All right, we'll have to wait and figure out our own path to make sure that we are not in trouble. There are some estimates that we will hit a third wave by October, but it might not be such a harsh one. Looking at our previous experience, it's difficult really to predict what will happen. What we do know for sure is that we can't let our guard down even now. Thank you so much, Professor Reddy, for joining us on this segment of the India Development Debate.
Thank you.